Welcome to today's press briefing. We have with us 4 speakers. They are Dr. Edwin Choi, Controller of the Center for Health Protection, Mr. Tony Wong, Deputy Government Chief Information Officer, and Dr. Albert Au from the Center for Health Protection, as well as from the Hospital Authority, Dr. Sarah Ho. We'll first hear from Dr. Choi. Good afternoon, everyone. Before we hear from Dr. Au, I would like to take this opportunity to report to you 2 items. First of all, today is the first day of face-to-face class resumption, so I'd like to announce some details about school arrangements. The other item is in relation to the implementation of the recovery record QR code. First, about schools. Some primary schools have resumed classes, so I'd like to remind parents that you need to take care of 4 things. Before children go to school, you have to do RAT for children, or I'll teach them to do it. They can only go to school with a negative test. There is plenty of information available, so I'm not going to go into details. Secondly, you have to monitor the child's health condition. If there is any symptoms, whether the test result is positive or negative, they should refrain from going to school and should go to see a doctor. Thirdly, they should vigorously observe environmental hygiene. They have to clean their hands, they have to cover their faces when they cough, and keep the masks properly on. If they have to eat at school, then they need to try to shorten the time with their masks off as much as possible, and be very careful when they need to eat. If children have not yet been vaccinated, please get them vaccinated as soon as possible. Scientific data shows that vaccination will bring merit to children. It's certain that vaccination will reduce the chance of serious cases as well as the risk of fatality. Many parents ask, if the test is positive, what should one do? This is in relation to RAT positive result. As I said, if the result is positive, do not go to school and make a report to the school. If there are siblings living under the same roof, they are counted as close contacts, so they should not go to school, and their schools should be informed as well. Go to our declaration platform to make a report. I'm not going to go into details. The address is www.chp.gov.hk/RATP. In relation to risk factors of those who have been affected, we use a tiered as well as a triage system. The same will be implemented for the most suitable isolation and quarantine arrangements for children. Those with no symptom or mild symptoms, and if there are no high-risk factors, children can be isolated at home if the domestic settings are suitable. If the domestic setting is not suitable, and if parents think that they need to accompany the children to go to isolation facilities, they can go to the isolation facilities at Penny's Bay, where parents can accompany their children. Previously, we've said that we allow parents to go with their children to hospital for admission, for isolation and treatment if necessary. We have opened designated clinics for COVID-infected patients. The objective is to treat patients with mild symptoms. If your children are infected, make use of our hotline 1-836-115, or go to the 23 designated clinics to seek treatment. Kindergarten pupils as well as primary students can also call us at our Patient Support Call Center. If they encounter any difficulties in making an appointment, they can make use of HA's care booking line to make an appointment. Apart from these designated HA clinics, there are 13 private hospitals that will provide medical services to COVID patients. So far, we have about 170 private doctors who have obtained antiviral medication from us. We are in the process of seeking consent from these doctors to release their names. We thank private doctors for their warm response in providing services to COVID patients. So apart from going to private hospitals, designated clinics, you can also visit these doctors. If you want to go to a hospital or a designated clinic, you can make use of our designated taxi fleet. You can see the website on the slide. However, if children suffer from serious conditions, please go to the A&E department. These include persistent fever, difficulty in breathing, lips turning blue, chest pain, heartbeat getting faster, signs of convulsion, and a loss of lucidity, as well as persistent loss of appetite or persistent vomiting. There are 13 private hospitals providing outpatient or remote consultation services. For some of these hospitals, they may not be able to provide a service for those under the age of 5, but there are other hospitals providing different medical services for different age groups. Today is the first day. So apart from reports being made to schools by parents, we also have a dedicated declaration platform for parents to report children's conditions to us. Let me give you some figures. For local schools, there are 52 primary schools that have resumed classes. 8 are on the Hong Kong Island, 14 in Kowloon, and 30 in the New Territories. Today is the first day of resumption. We find that there won't be any children being infected at school today. Anyway, schools have told us that there are 2 students with a positive test result this morning. They did not go to school, and they came from 2 different schools. For international schools, there are 56 of them that resumed face-to-face classes, 26 on the Hong Kong Island, 25 on the Hong Kong Island, and 14 in the New Territories. There are no students being infected on the campus. All the reports have been made to us by 10 a.m. One teacher has a positive result from RAT, and 12 students from one international school have positive test results. They did not go to school. They came from different grades. Because they did not go to school, so there is no special follow-up action required at these schools. For RAT tests, we can see that it is a very useful tool to quickly identify children with high infection risk. We believe that the source of the infection of these students are probably from the community. The second part is in relation to arrangements of recovery record QR code. Vaccine pass will enter the second stage on the 30th of April. Recovered patients may make use of relevant infection or recovery record in place of the vaccine pass. Starting from today, they can make use of an electronic vaccination and testing record to download the recovery record QR code. The address is www.evt.gov.hk. Members of the public may also make use of the electronic record app or the IM Smart app to download the QR code. I will defer shortly to Mr. Wong for details. If you'd like to make use of the access the system, you see on the left-hand side is a new interface. It is for testing record or recovery record. You press this, you see 2 choices. Where you will just read some data collection statements, and then you will enter into the system. You can verify your personal record using travel records, ID card, or birth certificate. Well, you have to make use of the same proof of identity used when you made the declaration on the RAT platform. For the three types of proof of ID, there are slight difference, but they're more or less the same. For ID card, you have to also enter the date of issuance, as well as the month in which the test result was obtained. If it's March, then you only have to enter the letter 3.
If it is a birth certificate, then the birth certificate number is to be put in. Date of birth is also to be punched in. And then the month tested positive. Say, if you use a passport or travel documents, then the number should be put in together with date of birth and also date or month of tested positive. After that, you'll get the recovery record, QR code. If you use iSmart, after you've logged in, you choose recovery record, and then there will be the information on the right-hand side and the QR code. Starting from today, as far as the isolation order is concerned, there's also a recovery record QR code. The QR code counts from the date of recovery for 180 days. There's date of recovery for 180 days, not today, and then count 6 months. So if your recovery date is 1st of March, and then in September is still valid, but after that it will expire. You have to carry this QR code to show the QR code to replace the vaccine pass in order to go into designated premises. You can also store this QR code in your mobile phone and then put it, give it for scanning when you go to designated premises. Now, this is the web page. On the right-hand side, you can choose vaccine pass, or you can use the recovery record QR code as an option. Your QR code will expire 6 months after your recovery. So the recovered person will have to meet the requirement of the vaccine pass and receive the suitable number of doses of vaccination in order to comply with the record. That will be your appropriate vaccination record. We suggest that the earliest is for the recovered persons to receive vaccination 28 days after within 28 days after recovery. Before recovery, if you have already got 2 doses, then after the vaccination, the record expired, then you can make use of the EVT and then download your vaccination record, and that will include your recovery record, and you can therefore meet the requirement going into designated premises. The QR code arrangement has a transition period from today and onwards until the 30th of June. You can still make use of the following documents to go into designated premises. And they are the discharge document, the SMS or electronic record or paper record issued by recognized labs and government labs, the isolation record, also test positive records issued by the CHP, and also recovery record issued by the government or HA. But it does not include a photo of RAT test positive. After 30th of June, after the transition, then you need to make use of the recovery record or the vaccine pass and meets the requirements in order to enter into designated premises. Earlier on, Dr. Au and his team has already within a month, received a number of inquiries from members of the public. They've inquired through email or telephone. They had RAT, and then they have difficulties in logging in to the platform. In the past month, we've solved the problems in terms of records. We've issued isolation orders to them. Some also mentioned that the Omicron infection leads to only minor symptoms. Some people have told us that they have sort of symptom, but they didn't do any tests, they didn't go to the doctor, so they are not sure whether they have already got infected by COVID, and therefore they ask whether they should receive vaccination or not. With regard to persons uncertain whether they have already been infected with COVID, the CHP's joint committees and also the science committees of the CE have looked at the data, and they all agree that those who are uncertain whether they have been infected, they should receive vaccination as those who have never been infected. Even if you've got COVID in the past, you can still receive vaccination safely. But the benefits are far greater than the adverse impacts. So there is no need for you to conduct any prior screening. If you look at your age group and then you receive the relevant doses of vaccination, then in order to meet the requirements. Concerning your recovery record, if you are doubtful about it, we have the number 25695777 for you to check. If you are not sure whether you have been infected, if you have seen our information, you better go to receive vaccination. There will be more benefits than harm. I have already I'm going to tell you briefly the vaccination requirements. If you are to receive Sinopharm injection, age 3 to 59, 3 doses, the first and second dose span of 28 days, the second and third dose 90 days. That's for the general public. For those above 60, the scientific committee proposed injection, another dose 90 days after the third dose. For those who choose BioNTech, for those age 5 to 11, the scientific committee proposed 2 doses within a span of 56 days. For 12 and 17, 3 doses. First and second dose, the span is 56 days. Second dose and third dose, 150 days. 18 to 59 years old, if they receive BioNTech injection, 3 doses. The span between the first and second dose, 21 days. The span between second and third dose, 90 days. For those 60 and above, 90 days after the third dose, they should receive the 4th dose. So much for me. For my report, I'll hand over the floor to Dr. Ao.
Thank you. Good afternoon, everyone. I will now report to you the number of reports we have received yesterday in relation to COVID-19. Yesterday, we have PCR positive cases, 320 cases. That includes 73 confirmed by the hospital authority, 56 by public health laboratory service, and the remaining 191 by private labs. And in relation to RAT tests, there are 280 positive RAT cases verified on our platform. Yesterday, we had 600 COVID positive cases. So far, we have, in the 5th wave, 1,186,607 cases. There are 743,239 PCR cases and 443,168 RAT positive cases. Of the cases reported yesterday, 11 of them are imported cases. The remaining 589 cases are local cases. Of the imported cases, 5 of them were confirmed at the airport via the temporary sample collection stations. They are from Singapore, Australia, UK, Germany, and France, and Thailand. For the remaining cases, there are 5 cases that were picked up from the quarantine hotel, 3 of them via PCR test on the 5th day. They came from Indonesia, South Africa, and Singapore. 1 is a 4th day RAT positive case. The person came from Singapore. The other one is RAT positive case from Singapore. The last one is someone from Australia. It's a 12th day positive case from a community testing center. The CT value is rather high. It's 36 to 39. In care homes, we have no new care homes that have not been infected. 7 care homes previously infected now report to us additional cases. 6 residents and 1 staff members were involved. There's also 1 care homes for the disabled that have seen previous infections. There is 1 additional case involving a resident. Of death cases, so far in the 5th wave, we have 8,963 death cases. Compared to yesterday, an addition of 17 cases. The overall death rate is 0.76%. The age range is the same as yesterday. I'm not going to repeat it. That's all for my report today. I'll now defer to Mr. Tony Wong from the Government Chief Information Office. Thank you, Dr. Choi. Good afternoon. Just now, Dr. Choi gave you information about the downloading and use of recovery record QR code. The way you can use it is similar to the electronic vaccination record. We have already put in place the vaccine pass previously. So you can use a vaccination QR code to enter premises. Well, for the recovery code, it's within 180 days from the date of recovery. So you've recently recovered, you can make use of the platform previously mentioned to download your recovery record QR code. You can use it to you can download it onto your Leave Home Safe app and scan it before entering specified premises. If you have received vaccinations, or if you have, under the requirements of vaccine pass, receive relevant doses, you can make use of IM Smart or eHealth app to download a vaccination record, including your recovery record. This will fulfill the requirements under the vaccine pass. Recovered persons can also go to community testing centers to ask to download the latest QR code. That code will include the person's recovery record. It can be used to meet the vaccine pass requirement. The second stage requirement is around the corner, and there is also the implementation of recovery record QR code. So we have updated the Leave Home Safe app to version 3.2.0. The updated version will carry a few new functions. Apart from supporting the storage of recovery record QR code, you can also store your vaccination record as well as medical exemption certificate. So you can choose any one of them as your default QR code to be displayed for vaccine pass. Say, for example, you've just recovered, you have 180 days to use the recovery record QR code. that meets the requirement under the second stage. You may make use of the updated Leave Home Safe app by using the new function to store your QR code. You can view the QR code stored, whether it is a recovery record or a vaccination record. It will display the time and whether it has expired, as well as whether it still meets the prevailing requirement. Say, for example, this version I have. In the new version, there is this stored information of a vaccination record. Say, I have stored a vaccination record of 2 doses. You may see this new function, this blue frame. The frame in blue shows that it meets the prevailing requirements under the vaccine pass. Well, when we enter the third stage, this frame will turn red if you have not received the third dose. You may store your medical exemption certificate or your recovery record. Well, I made this an expired recovery record, so the frame is red to tell you that the requirement under vaccination pass is not met. So you can, by looking at the color, tell whether you meet the prevailing requirement under the vaccine pass. This also makes it easy for premises to check your code. You only have to show the code and you can tell at one glance whether it meets the requirement. The information has already been disseminated in our thematic website of the Leave Home Safe app. We've also produced APIs to show members of the public how to use the latest function of the Leave Home Safe app, as well as how to upload information. We'll enhance our publicity. I would like to add one thing. Those who are above the age of 60 and those who are immunocompromised, you can receive your 4th booster. In order to make it smooth and easy to read a QR code, in order to keep the specification of a camera set at premises at a lower level. So you only have to store your recent 3 doses of vaccination to meet the requirement. We try to keep the content of the QR code simple so that it will not be too complicated. In turn, it will make it easier for premises to scan the QR code because they don't have to upgrade their equipment. The design is also in line with the need of the Leave Home Safe app. The design of the vaccination record QR code is not to be used as a complete vaccination record. This is just to meet the requirement of vaccine pass. If there are additional requirements under the vaccine pass, we will update the QR code of the vaccination record. The complete vaccination record will be stored at the Central Data Storage Center at the Hospital Authority. And the printed record also shows complete information of your vaccination record. You can also make use of your e-health app as well as your IM Smart information to check your complete record. Every time you receive an additional dose, you need to update your QR code in the Leave Home Safe app in order to meet the prevailing requirement under the vaccine pass.
方便執行
To facilitate premises that have to check the code positively, we have updated the scanner to 4.2.0 version. Apart from the original functions, the program can also identify the latest QR code and also check different types of QR code, whether the vaccine pass QR code is in line with the new stage of vaccination requirement. There is also an automatic checking and update function. The person in charge of the premises will have to update the version so as to meet the latest requirement. That will meet the various requirements of different stages. There's also a registering function so that person in charge of the premises and also the CHP will be able to know how many scanners are being used at the premises. And if there is a case of infection, then adequate information will be obtained as to how many people or how many scanners have got a record of the person who have entered, the infected person who have entered the premises, and also find out those close contacts. We've also a seminar for the catering industry to introduce to them the new functions and also to teach them how to use the scanner program. So much for my supplement. I'll call upon Dr. Ho to report on the situation of HA. There are 8,438 confirmed patients in all the public hospitals, North Lantau Infection Control Center, HA Infectious Disease Center, and also Community Treatment Facility at AWE. 4 patients were critical, 2 serious, and 50 critical patients in the ICU. As of 00:00 in the past 24 hours, 16 confirmed cases passed away, 8 males and 8 females, aged 33 to 97. Among those passed away last evening, 4 came from the homes. 10 have no vaccination record, and 3 had 1 dose. 3 had 2 doses. 13 were aged 65 or above. For those younger patients who passed away, the first one, a male, 33 years old. The gentleman had a drug abuse record, and he was seriously compromised with his immune system. When he was admitted, he had serious diarrhea. BP was very low. We immediately give him suitable treatment to help his BP, and he was sent to ICU immediately. And he was provided treatment and also resuscitation. We introduced remdesivir and also used antibiotics to reduce infection. Yet the situation deteriorated. We put him on a breathing machine, but finally the patient passed away on the 18th of April. The second patient, age 52, a man. He had cancer and spread to his brain, and also there was also blocking of his veins. Another one, age 58 man, he had cancer, and that was a relapse. He was high-risk person. Therefore, after he was admitted, after treatment, he passed away, unfortunately. Because of time lag in data, would like to report on a case which had not been reported. On the 17th of April, the patient passed away, a man 72 years old. In the past day, 597 patients discharged, 3 patients were confirmed because of in-house checking, and 5 close contacts. Among staff members, 21,915 had been confirmed COVID, and then 20,916 have come back to work. A show of hands, and please introduce yourself and your organization before you speak. Good afternoon. I'm from the Orange News. The school has resumed CHP, although the holidays have behind us. There is that there may be an increase. So if you can see that there is no serious deterioration, can you regard it as there is no rebound? Dr. Ho said that the data should include the age of those confirmed COVID, those age of those who infected, and also the situation at school, so that people know the community situation and adjust their activities. Will you follow his advice? And finally, Dr. Au has referred to a case imported from Australia in the community center, CD value 36 or above on the 12th day. Is there any genetic sequencing? And what sort of strain is it? Thank you. First, on the first and second question. The third question will be answered by Dr. Au. With regard to the incubation period of Omicron, that's about 3 to 5 days as the yardstick. We come across a situation that after a spread, and then after 3 or 5 days, there may be an increase. So if we are concerned during the Easter holidays that there were people gathering and there was a spread, then we have to wait for 3 to 5 days before we can see any change. This is the first day after the holidays, so the situation cannot reflect the true situation. We have to consider the trend. If we compare with the data provided by Dr. Au, 600, in comparison with the previous day, 613, if we base it on 600, then there's a small fluctuation. If the change is by 20 or 30, there will be a significant percentage. So we need to watch for a few more days. We'll watch the situation very closely. After school has resumed classes, we will ask the schools to provide us the situation report. We've consulted experts. We want to provide information as transparent as possible. Before the 5th wave, we can report to you on each and every case on our analysis, but when there are many cases, it will be difficult to go over each case in detail. We watch high-risk situation. We reported on the outbreak situation in the care homes. Dr. Au provided information just now. After school has resumed classes, we will report to you the numbers in due course. But the numbers reported at school may not reflect the situation of outbreak at school, because students do go back home, and there may be infection at the community level. And the students don't go to school if they're infected, so they will not be reflected in the cases at school. We have to consider the number of absences at school and then tally that with the outbreak. Dr. Au will check whether there is an outbreak at schools, and if there is an outbreak at school, then we have to do our work. We have to check the reason for the outbreak, whether infection control is not good enough, and is there any ventilation problem. There are various ways. We can have infection control measures tighten up. We have to make sure that the ventilation system at the spot of outbreak is adequate. Of course, we don't want to do that, but it may be a measure that is required, and that is some classes, some classrooms or even some schools may have to be suspended in order to prevent the widespread of the disease.
That's all for my report. I will defer to Dr. Au about the case that was picked up on the 12 days. Yesterday, there were 11 imported cases. There was one case that was picked up by a community testing center on the 12 days. He's a 15-year-old boy, a student arriving from Australia on the 6th of April with his parents. They completed the 7-day quarantine at the designated quarantine hotel. Samples obtained, whether they are PCR tests or RIT, are negative. It's an asymptomatic case. On the 17th of April, in accordance with the compulsory requirement, a sample was obtained. It's positive. CT value was 36 and 39, so it's rather high. That means the viral load is low. It's an asymptomatic case. Parents' test results have been negative. We've done some preliminary investigation. At the same time, on the same floor, in the same hotel, there are no other cases. So we think at this stage that it is a retest positive case. Next. The lady over there. I'm from cable TV. I'd like to ask about the arrival from Australia, the case picked up by Community Testing Center. Is there any suspicion that it's a BA.4 or BA.5 variant? It's not the first time that there is a positive case after the case entered into the community. Are you concerned about any spread in the community? You mentioned about a school with 12 students with positive tests. What's the distribution of grades? Do they know one another? Are you concerned that perhaps they were in a gathering during Easter, that's why, which may give rise to an outbreak at the school? Today, primary schools will resume face-to-face classes. The children are older, so nasal swab might be fine. But what about kindergarten pupils? They are rather young. There may be difficulties trying to get a nasal swab from them. Any advice for parents? Perhaps I will answer the second and the third questions. The first one I will defer to Dr. Au. In relation to a school with 12 positive cases, we believe that it's quite certain that is infection from friends or in the community, because today is the first day of school and they were tested positive. They did not go to school. The source of transmission is difficult to tell because we have cases locally, and there is a chance that it may be an infection from gathering. 10 of them are primary school students, 2 are secondary students. So 12 in a whole school is about 0.5% of the school population. Let me say this again. We are glad to have this new system under which parents can do RAT for their children before they go to school. So this reduces transmission at school. Schools, after collecting the information, will report the information to us by 10 a.m. These cases show that they might be infected from the family or from the community, but we don't rule out the possibility that in a few days there might be infection from the resumption of classes, but we at least have the basis to carry out further investigation. In relation to obtaining nasal swab from tender-age children, I think we need the help of parents. In the past week or so, we have done a lot of publicity work including our colleagues in the Education Bureau. We try to help parents to do RAT. I understand that pediatricians have also given some briefings to parents as to how to get nasal swabs from younger children. There's no need to panic if there is some bleeding, because it may just be a small tear in the membrane in the nose. Practice makes perfect. When you do it every day, you will be quite skillful one day. It's just like taking of temperature. At the beginning, you may feel quite awkward, but then you get very good at it. I'll now defer to Dr. Au about the imported case. The case that's picked up on the 12th day is a sample obtained at the community testing center. The analysis is done by a private lab. We asked the private lab to forward the sample to our public health laboratory for genome sequencing. We have yet to receive the sample. From previous imported cases, the majority of them were picked up at the airport or at designated hotels. It shows that our current measures to prevent imported cases are effective. We'll deal with these cases very carefully. Samples tested positive will be forwarded to the public health laboratory for verification and genome sequencing, so that we'll know as soon as possible whether there are new variants entering Hong Kong. There's also a vigorous testing regime for those staying at designated quarantine hotel. They have to be tested every day, and the 5th day is a PCR test. For those with 2 doses, the 7th day, the person can leave the hotel. But there may be some cases with a longer incubation period. That's why we require our compulsory test on the 12th day. This is to prevent possible cases entering the community. From the data we have, there's only a very insignificant amount of cases that are picked up on the 12th day. We are very cautious, and we will conduct epidemiological investigation of these cases to see if there are new strain of virus. We will also see whether there are cases on the flight, whether there are cases at nearby rooms in a hotel, the CT value, and whether it's possible that it's a previous infection. For the case I mentioned today, I have already given you the details. On the same floor of the quarantine hotel, there are no other cases. So we preliminarily rule out the possibility of infection at the hotel. The gentleman over there. I'm from Hong Kong 01. I would like to ask about the recovery record. For the platform, someone's filling the information, but the system tells them that there is no such record. Is it the case that, if it's not done properly, you can't get the record? Anything to do as a remedial measure? You also mentioned about seeking consultation at private clinics. Do patients have to take the designated taxis? What measures are there to prevent transmission? You talk about 12 positive cases, RAT positive cases at international schools. Which school, can you tell us? Well, there is only one international school. Is it the case that the other international schools have not reported the cases to you? I would first answer about private doctors. We look forward to a wider network to provide services for patients. That includes designated clinics of the HA, private hospitals, and private clinics. Our current designated taxi fleet can serve those who are going to designated clinics as well as private hospitals. The next stage, when we have a detailed list of private doctors, we'll definitely liaise with relevant departments as to the possibility of expanding the service capacity of the designated taxi fleet, providing point-to-point service to patients. But we do need a list of doctors first. To answer your first question in relation to getting the QR code, well, if it's a case reported to us, whether it's a PCR test or via the RAT platform, if it's a successfully reported case, the information will enter our data bank. It's linked to the vaccination record, so you will be able to obtain the information.
Suppose some recovery persons were not successful in making the report to us. If they were tested positive, they can send an email, ratp.gov.hk, and check his or her own record. We know that some people had previously tested positive, but they are unable to get the recovery record. The telephone hotline is 25695777. They can call a hotline. For recovered persons, after their recovery, they have to receive suitable doses of vaccines. And receiving vaccination is safe. If you are not sure whether you have been confirmed, then you can follow our advice and receive the suitable vaccination. Let me add, in respect to the schools, the QR code is for those who have confirmed infection records within our system. In the fifth wave, there are more than 1.18 million records in our system. Dr. Au and his team has received many inquiries. Some received a PCR record, but they have not received our isolation order. They may have used another telephone number, so we can give them a supplementary record. If they use the new system and then no record is found, then they have to make sure whether they have used another number. Say, for example, they've used a passport number is an ID number, and they have to check that. If there is no such record, indeed, then we have to conduct an investigation why they have a confirmed record and we don't. You can call the number 25695777 and also the RATP at gov.hk. As for schools, let me stress once again that on the first day, we know the reporting system has been operating smoothly. As for the other 65 schools, they reported to us there was no infection case. With more and more schools resuming classes, we make sure that the system is sound. These 12 children certainly were not infected at school because school wasn't open. Dr. Au will look into that. Why 12 students in the same school got infected? If we check the number of classes, in some classes there were 2 students in each class for 2 classes, and then the remaining were spread within different classes or among different classes. They might come into contact with each other during the holidays. We cannot rule that out. You worry, if you worry whether the schools do not report or the parents do not report, then we'll work with the school and to ensure that the parents do the test properly and report properly. Yes, am I getting through? Yes. I'm from the Dot News. For those 5 to 11 years old, they received the first dose, but only 70 of them have done so. Among those 3 to 4 years old, the vaccination rate is only 40%. There will be outreaching teams going to schools to provide vaccination. Will you continue with the scheme? Will you mount a territory-wide campaign to do that? With regard to primary school students, concerning the vaccination rate, recently it may not be a little bit not so as expected. Probably because some parents feel that the situation was not so tense. They have slowed down in bringing the children to vaccination. But COVID is still there, and when the school is reopened, there's a higher chance of getting infected. So vaccination is an effective means in reducing death and serious cases. As for measures to strengthen vaccination, parents can bring their children to various vaccination centers. There are many of them throughout the territory. If you're willing, when you go to any center, your children will receive vaccination easily, as long as you go. Can there be more incentives? That can be done by sending outreaching teams to do vaccination at school. We are working with the CSB to do that. But we have to consider this. We need to have adequate number of students receive the vaccination to make it effective. If there are just two students who will receive vaccination at school, that's a waste of manpower. So we do need the consent of parents. And let me encourage, once again, the parents. If your children have not yet received vaccination, you have to know that vaccination gives protection to your children. There is more benefit than harm, especially for those in primary schools. If they've got 2 doses, serious cases or critical cases are 8 times less than those who have not been vaccinated. Next, the last one, the lady here. Good afternoon. Which organization are you from? RTHK. Does the CHP announce, or will the CHP announce the number of infection at school? And when will you stop a particular school, suspend a particular school? Will you do contact tracing before you decide on suspending the school? As for RAT, reporting is voluntary. For one reason or another, somebody misreporting on the RAT platform. If he has already recovered, is any way to remedy the situation for making subsequent report concerning the 12 positive cases at a particular school? Will you trace whether they have any gathering or activities? Now, concerning the school's case, we will try to be transparent concerning the situation at school. At 4:30 every day, we will be able to understand any special circumstances or situation at schools. When there are cases in the community, a child may get infected at home or in the community, but it doesn't mean that the school has an outbreak. We give you the numbers. The most important thing is for us, and also Dr. Au in particular, to check whether there is anything special at a particular school. Say, for example, in a certain class, there are a large number of students infected. Or at a school, say there is a teacher group or a student group which has been infected, say, for example, an interest class. We will report to you the special situation. We don't have any hard and fast rule as to whether we require a particular school to suspend its classes. Now, today we have 600 local cases. We really need to consider the details of the situation of the cases of those schools. Infection control or strengthening infection control will help to control the spread. In this wave, we can do more because we have the RAT. If there is RAT before school, and then the child can stay at home instead of going to school, and that will help to prevent spreading at school. And there is still a case of infection, of course, because of the adequacy of RAT. We will consider the trend and also the situation at school every day.
What's your second question? We have in the past come across cases in which there are special circumstances, say for example, a late report using the platform. We would ask questions to find out why. In some cases, they could produce the result of the RAT, perhaps because that person was indisposed, that's why they could not give us the information. We try to provide assistance to these cases as far as possible to help them get the certificate or proof required. Last question, I'm from Mingpao. First, Dr. Choi. How would you know when the person recovered? Because you only report the date of testing. So for some people, it may take over 10 days to recover. In relation to the recovery record QR code, if I want to meet the vaccine pass requirement, do I have to follow the Joint Committee's advice to get vaccinated on schedule, or can I simply use the recovery record QR code to meet the vaccine pass requirement? So do I have to get vaccinated or not? Over 1 million people have been infected. Are there any constraints in terms of capacity on the platform? Will there be congestions? In February, there was a serious lack of issuance of isolation order. Will these cases have difficulty in obtaining their recovery QR code? You mentioned about 170 private doctors. Have you received from any individual doctors that they do not want to disclose their names? What are their concerns? If you can't disclose the information of the clinic, then it will lose its significance because patients will not know where to go to seek treatment. About the Australian case, 12 days. What about the boy's vaccination record? Any infection records of the boy and the family? What's the flight number? Any other passengers infected on the same flight? The whereabouts of the boy, especially over Easter, after leaving the quarantine hotel. Yesterday, there was a 10-year-old girl who was tested positive on the 12th day. Have you completed the genome sequencing? Is it similar? Is the result similar to local strain? And you talk about a case from South Africa. Any information about the strain of the virus? Any L452R or any BA.2? I'll defer to Dr. Out about the imported case, and I will defer to Mr. Wong about the volume, the capacity. Well, the recovery day, we count 2 days. 14 days after the positive test date. Sometimes if you're asymptomatic, you don't know when you recover. So we count 14 days after the date when you test positive. The second date is date of discharge. For people who need hospital treatment, the recovery date will be the date of discharge from the hospital. The validity of recovery record or QR code is 6 months. But does it mean that within that 6 months you don't have to get vaccinated? These are two different concepts. If you want to protect yourself, the Joint Scientific Subcommittee is very clear on this. You can get vaccinated 28 days after recovery. So if you follow the interval suggested by the committee, you can get the next dose after 28 days. Currently, we talk about 3 doses. So if you have been unvaccinated, then you are infected, then you need 2 doses following the suggested interval. But there is currently a measure under which when you have recovered, say you recovered today, you obtain the QR code, you can make use of this code in the coming 6 months to enter premises. But entering scheduled premises and offering yourself protection are 2 very different things. So it doesn't mean that if you have the recovery QR code, you don't have to think about vaccination, because you have to get the second and third dose sometime in the future. I'll now defer to Mr. Wong about the capacity of the system. Just like any large-scale information system of the government, we will put it on the government cloud, which has a sufficient capacity. We will also monitor the volume of traffic. If necessary, we will enhance the capacity. We have plenty of experience in running a queuing system. So there is the queuing arrangement. If there is a surge in traffic, the system will not stop. When traffic's low, you don't notice the queuing system because you go straight into the system. We monitor the system round the clock. We will ensure that it will operate smoothly and in a normal way. I don't have the information, but my understanding is that per minute we're talking about tens of thousands of access. Let me supplement about the issue of private doctors. We're glad that when we have put in place the platform to obtain antiviral drugs, 170 doctors have placed orders with us. We have already dispatched the medication to them. We have over 100 doctors who are willing to see COVID patients. We are in discussion with these doctors. We would like to publish a list so that members of the public will know who is the doctor in their neighborhood that they can go to. Some of them are very willing to give us their information. There are some doctors who will need to first put in place anti-infection control. Say, for example, by means of telephone appointment, because segregation of COVID patients from other patients will have to be done. They need to put in place a good workflow before they can give us their names. In the end, they need to segregate patients, say, for example, by physical partitioning or partitioning by time. It's only been a few days. We hope that we'll be able to disseminate the list as soon as possible.
As for the case on the 12th day, according to information in hand, the patient had 2 doses. By CX100, the patient arrived on the 6th of April, and on board there were 2 cases in the same flight which were picked up at the airport, but they were not related. We did contact tracing, and we also made arrangement for family members to be quarantined. That we apply the same to these cases. Another case was confirmed today, and we get the sample for genome sequencing. Same for the other case. We will do genome sequencing. If we discovered any thing abnormal or particular, then we'll report. As for we'll tell you. As for the South African, the case from South Africa, the person arrived at Hong Kong on the 13th of April by ET 608. On the 5th day, the person was tested positive. We will do a genome sequencing. That's the end of the press conference. Thank you very much.